Biomechanical Pain Made Simple, Part 2. As we discussed in Part 1 of this video series, biomechanical pain is caused by a repetition of movements or positions that your body doesn't like. It is pain that develops over time. Biomechanical pain can be caused by too much movement, overuse, by not enough movement, immobility, or by faulty movement, inefficiency. In the first video we looked at simple biomechanical pain, now let's look at its evil brother, complex biomechanical pain. Complex biomechanical pain. You always knew you had slightly dodgy knees. If your body grumbled about overtraining, it would always be the knees that grumbled the loudest, especially the right one. Occasionally they would both feel stiff for a week or more. Over time you also found yourself becoming more reluctant to do the longer runs. You turn 45, and noticing that you aren't quite as lean and mean as you were, you decide to give CrossFit a try. It turns out that you love it, but your knees don't feel the same way. 8 gloriously savage weeks of killer CrossFit sessions later, your right knee is feeling stiff almost constantly. It even starts making a small cracking noise with certain movements. After 10 weeks of CrossFit, your knee emits a sharp catching pain every time you bend it, and you find that you are starting to limp. Cutting a long story short, your physio immediately suspects a meniscus tear, it is confirmed and ends up needing keyhole surgery. The surgery works really well. It leaves you pain-free, but the knee feels very weak. Your physio explains that the whole leg on the bad side has been weaker for a long time, which is how the meniscus became frayed and eventually torn. On top of that, you've now also had 3 months of pain and surgery, it's become even weaker. There is serious work to do. After 6 months of strength exercises and regular physio for the weak leg, you make a cautious and humble CrossFit comeback. Twice a week instead of 4 times a week. This is a classic complex biomechanical pain scenario. Long-standing weakness in the leg caused wear and tear in the meniscus. Then a sudden increase in workload brought the long-standing situation to a head. Complex biomechanical pain is caused by repetitive movement the body can't handle. If your simple biomechanical issues are bad enough, the strain may eventually cause complications. Or put simply, simple biomechanical pain times severity equals complex biomechanical pain. The most well-known complication in complex biomechanical pain is wear and tear to joint cartilage. Other changes can include bursitis, cartilage tears, disc herniation, scar tissue, meniscus tears, tendon tears, rotator cuff tears and stress fractures. The damage in complex biomechanical pain is often mistaken for true injuries, by patients and doctors alike. It's entirely possible that you have had an injury that was really wear and tear to a tendon or a muscle that finally gave way. Many of us have. The nuances that separate simple and complex biomechanical pain, and how they connect to topics like injury are often brushed over in our society. This can be problematic because it frequently robs us of the ability to work on prevention. Identifying patterns that may later lead to complications is the key to preventing pain and tissue damage. Complex biomechanical pain is extremely common, especially in people who have had pain for a long time, people who have a history of injuries and people who have certain genetic tendencies. I suggest you give us a call to make an appointment to examine you and determine what exactly the problem is that is giving you pain, and work together on a treatment and rehabilitation plan to get you moving and pain-free again. Call us on 04385 6446 now,